This week we are talking about ballistics, and particularly we are talking about shooting deaths, which involves trajectory and trajectory angles. And we are going to be using my little mannequin head here that is made of styrofoam. So we are going to be talking about different types of trajectory angles, particularly in suicide types of cases. Now, a couple of different terms that we need to talk about first before we get into trajectory angles are going to be perforating and penetrating wounds. So perforating is going to be what we call a through and through wound. Okay, so through and through wound is going to be with an entrance and an exit on the other side. So entrance and exit, okay? It's going to be a perforating wound. And I will also write that here on the board for you as well. So this is going to be a medical term that we use, and what your pathologist will also use as well whenever they write this on any form of documentation. So a through and through, or entrance and exit. Okay, the alternative to that is going to be a penetrating wound. Now, a penetrating wound will have an entrance without an exit. Okay, now a lot of times we see that with a smaller caliber weapon. So typically what we would see with the 22, a lot of times there's a misconception that a 22 will bounce around. Now, a lot of times that is going to be determined upon where the entrance is. Okay. Penetrating is going to have just an entrance wound. Doesn't matter where it's at in the body. So perforating or penetrating can happen anywhere in the body. Okay, so a penetrating wound is just going to have an entrance, and that projectile is still going to be inside the body. It is just an entrance. With the projectile still inside the body. So as I was stating before, it is going to depend on the caliber of weapon that you're using and different firearms, of course. So especially with shotguns, a lot of times shotguns aren't going to have much remains of the head left behind. So especially if you are doing something that is intraoral, so that's through the mouth, or submentum, that's under the chin. A lot of times that is going to expand. So a lot of times when people shoot intraorally, a lot of times they will close their mouth around the firearm. So when they do that, they will clamp down around the firearm, and then what happens is the gases from that weapon, once the shot is fired, is going to cause that expansion of gases around that firearm, and then that expansion is going to blow out around their cheeks, from their mouth. So you're going to see some ripping and tearing around the mouth, and a lot of times teeth are going to be fractured as well. Firearms is just going to cause an expansion of the face outward as well as into the cranium. So a lot of times you're going to see this mushrooming effect of the head entirely. And so intraorally that happens. A lot of times submentum, what happens is the front of the face is just fully gone. So we're going to be talking about different trajectory angles and how that has a huge impact on how we determine if it's a suicide, homicide, or accidental. So in different angles or different spacing of abrasions and gunpowder can also have an effect on that as well, which we'll get into next week. So today, when we're talking about different trajectory angles and just different places where people shoot from, can have a big impact on how we investigate the case also. So we have different spots or different locations that we call typical or atypical. So atypical is just what we would consider to be unusual. So atypical is just unusual. All right, so those a lot of times would be a red flag or a warning as an indication to an investigator of like, this is probably some foul play on scene. So most of the times what we see in suicide cases of firearms for trajectory angle is going to be from the temporal regions. Now, right or left side, a lot of times too, you're going to take into consideration, is this individual right or left-handed? Okay, so a lot of times someone's right-handed, they're going to shoot themselves on the right temple. Okay, now this is a typical place where someone would shoot themselves. So into the right side entrance, and then left temporal region would be a normal exit wound. Okay, so a lot of times whenever a doctor is writing up their report, they're going to say trajectory angle of entrance right temporal region and an exit upward and to the front or to the left exit. And so if it doesn't, remember it's going to be penetrating gunshot wounds. So they might just say entrance right temporal region with projectile remaining inside the skull. Okay, so we're going to have entrance right, and then they're going to explain trajectory angle. A lot of times they'll do exactly what I'm doing. They'll take a dowel rod and they will do the same exact thing, and they'll document it with pictures. Now, if the projectile is still within the head, they will document that with x-rays, CT scans, etc. All right, so like I said, this would be a typical, not atypical or unusual of an abnormal thing that we would see for suicides. Another one that would be normal that we see, and sometimes we call a double tap, would be straight to the sinus cavity. And a lot of times you see what we call double taps when you have a smaller caliber type of projectile, and you don't always see an exit wound either. And so that's going to be straight through the sinus cavity, and a lot of times those aren't going to exit. Now you have a lot of small bones inside the nasal cavity, and so that's why that's not going to enter into the brain from there. Okay, so a lot of times people live through that, and that's why they have to shoot themselves again. So if you have something where there's two casings and you're like, oh, that seems unusual or suspicious, okay, you might take a look and see what type of caliber it is, and then look at the location of where that entrance wound is. A lot of times there will be a second entrance wound close by, okay, or the initial first shot is going to be in the sinus cavity, and then maybe a secondary one to the temple or submentum. All right, now that submentum, okay, like I said, is going to be up underneath this chin here. I'll try not to stab myself. As you can see, what happened here is I had a very bad angle. The same thing also happens quite frequently when people shoot themselves under the chin, okay? And then what happens is what we call canoeing. So canoeing happens when people don't get the right angle, and then what happens is they just shoot off the front of their face instead of shooting back into their brain. And so they do actually end up living, and then they have to have a major reconstructive surgery or many major reconstructive surgeries. And then it's a very long, hard life for them after the fact. Now, some other suicidal forms you'll see are going to be intraoral, like I was saying, so straight through the mouth. Typically what we see happen is once we go intraoral, what's going to happen is you will have an exit out through the back, so straight through the mouth. And a lot of times, like I said, people will clamp down on that and bite down. Then you'll have an exit through the back. A lot of times what happens is it will strike the spinal cord. So it's a very quick and easy death. Now, ones that are going to be unusual, you don't actually see many that are going to be straight through the forehead here. A lot of times you'll see those more in assassination type of cases or drug death kind of things, where people are having to kneel down in front of them. They're going to come point blank blank and shoot them in the forehead, or you're not going to see someone turn around and point the gun to the back of their head. It's a little bit harder to get this angle here where they're having to turn around and get a lot of leverage. This is a very hard position to get a lot of leverage to the back of their head. So this is a very atypical or unusual position to get this angle from. So especially if it is a longer weapon, it's going to be hard, or a weapon that has a lot of kick to it. It's just not something that you're going to see. So you might sometimes see some that are going to be behind the temporal region, behind the ear, or in the occipital lobe. So you might see this sometimes as well. Now, there are some people that you will see that have multiple gunshot wounds to the head. That's not always unusual or atypical. It depends on the type of round that it is. So a lot of times, the smaller the projectile, sometimes the more gunshot wounds that you will see in suicidal cases.